If your glute medius are weak, it can lead to back pain, hip pain, IT band syndrome, ACL tears, and kneecap pain. Researchers in 2011 looked at the most effective exercises to strengthen your glute medius, and I'm going to go over them in this video. Your gluteus medius attaches on the outside of your pelvis and inserts down on the upper part of your thigh. Its main function is to keep your pelvis steady when you're standing on one leg. And that's way more difficult when you're running, or even more so sprinting or jumping. So injuries down the chain in the knee can occur when you don't have control of that pelvis when you're moving in that direction. Researchers in the study looked at each exercise's ability to maximally fire the glute medius, and they use an MVIC, or your maximum voluntary isometric contraction. So they basically do a 1RM test with a force gauge to see how much force you can produce, then do the exercise and determine the output by putting little sensors over the muscle and see how close it gets to the maximum. So one of the exercises that's most commonly prescribed for hip abduction strengthening, targeting the glute medius, is side-lying hip abduction. That came in relatively high in the study at 62% of your maximum voluntary isometric contraction, or 62% of your max. Now when you're doing this exercise, there's a couple key points. We want to make sure our pelvis is stacked. So the working leg on the top, this half of your pelvis should be directly over the bottom half of your pelvis. Normally we see people cheat where you'll rotate back so you can use your hip flexors, but we're wasting our time when we do that, so keep them stacked. The other thing we want to avoid is bringing that hip forward. We want to keep it as extended as we can. The goal, I'll tell patients, is to have a straight line from your shoulders to your hip to your ankle through your knee. And then you're doing your repetitions. When you come down, you stop when your leg is parallel with the ground, and you'll feel a big difference when your leg is back extended compared to when it's more in a forward position. There's multiple fibers of that glute medius. You'll target different portions of it based on where your hip is during the exercise. The next exercise that researchers looked at was a plank with a hip extension. This actually came in at number 1 when they were looking at glute max, but for glute medius, it also came out strong. So if you're looking to attack both muscle groups with one exercise, this is a great choice. You're gonna get in your standard plank position, hold the plank, and then from there, you're trying to extend the hip, hold that for a few seconds, back down. I like to make sure we do the same side in a row so we can get fatigued before we switch. You certainly could do alternating, but you're not going to get as direct of a training effect as you would if you rep out your one leg continuously to failure. Good rules for this exercise are to try to maintain a straight line again, shoulder to hip to knee to ankle. We don't want our butt too high in the air. And then when we extend too, we want to make sure that our hip's not dropping. When that leg goes up, we don't want that hip to drop, because its job is to maintain stability of that pelvis. The front plank with hip extension scored 75% of max, edged out just barely at 76% of max with this next exercise. They looked at 4 different types of clamshell positions. Clamshell is another exercise we prescribe all the time in physical therapy to strengthen the hip rotators and abductors. Classically, a clamshell is separating the knees, but the position and the movement that scored the highest was with the hips all the way extended, this top leg extended back and stacked, and then rotating actually in the internal rotation of the hip, where the ankle is coming away from the ankle below it. You can set a metronome so you have consistent cadence of your repetitions, and then go through 15, 20 repetitions, build up your endurance by doing more reps. Okay, you can also make this more difficult by adding a weight or resistance band around your ankles. You want to make sure your head's supported either with a pillow or with your arm when you do this exercise, so we're not putting any unnecessary strain on your neck. The next highest score at 82% of max was a single leg squat without load. You could increase this further by adding load. We like to have patients do it with a rest point, kind of like you would with a box squat, where you're just essentially doing a sit to stand from a varied height. The lower you go, the more difficult it is, and you're just trying to go up, tap, and then back up again. You do this exercise, you can do your strength principle somewhere in that 6 to 12 rep range. Once you can get 12 to 15, and you can add load or drop your surface, and do that 3 times a week if possible. You'll probably notice a difference when you compare your right or left, because almost everybody has a slight strength asymmetry putting more risk for injury on that side where your hip is weaker. As an alternative, you could make this more difficult by putting your back leg up behind you so you get a hip flexor stretch, and that rectus femoris quad muscle group has to work on that back leg to assist. It's also much more challenging for your balance, so make sure you can master the sit to stand exercise version of it first before you go into more difficult versions. The top dog of all the exercises measured in this study in terms of percentage of max was sideline hip abduction from a side plank. Hold that side plank position, both legs together, and then you're going to abduct the top leg. What they found was the top leg lift was around 89% of max, and the bottom leg was 103% of max voluntary isometric contraction. So able to actually get more force production from doing the side plank on that bottom leg than you were when you were just doing a max test. There's something about the weight bearing that allows for more force production in that muscle than you would otherwise be able to produce with a max test. To watch another video to see if you're vulnerable to injuries related to running, click up here. To see more videos where I expose the truth about the musculoskeletal system to help you prevent unnecessary treatment, subscribe to the channel, click over here. You want to keep improving, you got to keep it moving.